Are stroke treatment options typically expensive? When considering the cost of stroke treatment options, many factors come into play. The expense can vary significantly based on the type of stroke, its severity, and the healthcare system in place. Generally, stroke care tends to be costly due to the need for quick diagnosis, specialized imaging, and advanced treatment methods. First, diagnosing a stroke quickly is essential for effective treatment. This often requires advanced imaging technologies, such as computed tomography scans or magnetic resonance imaging. These technologies help determine whether the stroke is ischemic or hemorrhagic, which is crucial for guiding treatment decisions. The market for stroke diagnostics is growing rapidly, reflecting the demand for early detection and the associated costs. The global stroke diagnostics market is valued at several $billion and continues to expand due to innovations in imaging and artificial intelligence. For acute ischemic strokes, the primary treatments include intravenous thrombolysis and endovascular thrombectomy. Intravenous thrombolysis involves using drugs like alteplase to dissolve clots, while endovascular thrombectomy is a procedure to physically remove a clot from a blood vessel in the brain. Both treatments requiring specialized equipment and highly trained medical staff. The costs of thrombolytic drugs and thrombectomy devices are high, and the procedures themselves demand significant hospital resources. After the acute phase, many stroke patients need hospitalization for monitoring and rehabilitation. The length of hospital stays can vary, but longer stays and more intensive rehabilitation services will increase costs. Rehabilitation often includes physical therapy, occupational therapy, and speech therapy, all of which add to the overall expense. Long-term care and medications are also significant factors in the cost of stroke treatment. Stroke survivors frequently requiring ongoing care, medications to prevent another stroke, and continuous outpatient therapy. These ongoing costs can be substantial, especially for patients facing significant disabilities. High costs can create barriers to accessing advanced stroke treatments, particularly in low- and middle-income countries or for patients without adequate insurance. The development and delivery of new cardiovascular and stroke therapies often involve lengthy and expensive clinical trials, which can drive up prices and limit availability. The stroke treatment market is evolving, with new technologies and therapies being developed. Innovations like artificial intelligence-powered diagnostics and remote monitoring are expected to improve outcomes but may also raise costs in the short term. However, these advancements could lead to more efficient care and potentially lower long-term expenses by preventing complications and enhancing recovery. While stroke treatment can be expensive, timely and appropriate care is vital for reducing disability and saving lives. Patients and families should work closely with healthcare professionals to understand their options and explore available resources, including insurance coverage and financial assistance programs. In summary, stroke treatment options are typically expensive due to the need for specialized diagnostics, advanced therapies, hospitalization, and long-term care. The costs can be a significant barrier for many patients, but early and effective treatment is critical for improving outcomes. Always consult with a healthcare professional for personalized advice and to explore available treatment and support options.